So today I'm going to talk about the importance of standing CT for the diagnosis in lameness in sport horses. This is actually a pretty important topic when it comes to trying to establish the diagnosis of pathologies in sport horses. When it comes to the clinical challenges, this is something that we all get confronted with, the challenges of what we need to do in order to help these horses. The idea is always to go and try to get a proper, accurate, and early diagnosis. And I'm going to make an emphasis on early diagnosis, and I'll explain a little bit why. As long as we have diagnoses, then we're going to be able to choose what the appropriate treatment modality is going to be. Also, very correlated with the diagnosis is also being able to provide a plus or minus the most accurate prognosis that we can give the client. This is something that, at least in my caseload, I get asked a lot is, okay, well, can this horse come back and compete? And having a diagnosis helps quite a bit on trying to get a prognosis too. Like any sport horse, everybody wants those horses to be ready to perform as soon as possible. So the earlier we get to the diagnosis, the sooner we can get there, then the earlier or the sooner we can bring these horses back to full performance. One of the things that's very important too, in the case of trying to get an early diagnosis is the sooner we can get there, the less damage to bone, ligaments, tendons, and joints, and specifically irreversible damages. Remember that at this point, when we have cartilage damage or some tendon and ligament damages, if they're mild and we get there sooner, that's going to help us, avoid these damaging changes that can impact horses in their sport career. How are we going to do this? We'll do this in a step-by-step approach, just like it's being taught in these modules. We'll start with a good physical exam and history, get a very good hands-on examination, correlating that with a very good active examination of the horse. And when it comes to try to get a diagnosis and specifically choosing the proper imaging modalities, is try to accurately localize the area that we feel that's affecting the horse, right? So when it comes to thinking about imaging modalities such as CT and MRI, you always want to try to localize everything. That way you can narrow your field of interest and basically putting those diagnostics in that area to try to get a diagnosis. The one thing that CTs and MRIs are going to provide is an increased sensitivity and specificity. This is significantly different than what X-rays and ultrasound can give you. And just like I mentioned beforehand, you always want to try to localize the anatomical area. And as we know, with all the different studies that are out there, specifically the ones that talk about diffusion of your nerve blocks and joint blocks, always be prepared to image or to look in the areas outside the boundaries of the block. So that's something that's very, very important to keep in mind. When it comes to diagnostic imaging, probably after the 2000s, we ended up having the ability to do MRI under general anesthesia, and the first standing MRI units were coming out in the market. There's a big difference between imaging quality among the general anesthesia in the standing units, not only in regards to MRI but also on CT. But the fact that we can have a very good or strong correlation between those under general anesthesia systems and the standing system provides a pretty big plus for the equine world, because beforehand we would just rely on X-rays and ultrasounds to try to figure things out. And if we wanted to have anything or higher diagnostics, we would have to think about general anesthesia. And The good thing is that nowadays we do have these standing modalities that have been a pretty important tool in our arsenal to try to get to diagnoses. When it comes to standing CTs, these are probably the systems that are out there in the market. The two top ones are fan beam CTs. The three on the bottom are cone beam CTs. I'm not going to get into the physics of it, but there are differences in regards to imaging and how that imaging gets impacted when the horse moves. And that's something that, for those of you who have been exposed to these standing modalities, is the horse can sway or move. And, sometimes you have to repeat the image in order to get rid of that motion. So these are the systems that we have out there. A little bit of the story of my clinic, and why we chose, we went out in the market to get one of these standing CTs. And for us, it was very important to have something that it was easy to manage. And for us, it's something that provided us with the easy to get these horses in and out, in order to get their image and be able to do it in a safe and in a fast way. In our case, University of Minnesota, we decided to go with the ASTO CT. This is one of the CTs that is specifically built for horses. One of the big things that we were looking for is being able to operate them, and you can see that on the video when it comes to front limbs and hind limbs, try to get as high as we can, which is distal tibia and distal radius, and try to do it in a fast way. And for us, one of the important components of these CTs is being able to get both limbs in that image. Now, we are aware that we were sacrificing quality of image compared to other units, but there's different things that we can do to supplement that and to try to get or find a way to get a diagnosis. So this is our system that we have in the university. We've had it since 2019, and it's worked pretty good for us. The advantages, 3D imaging, a high spatial resolution. We all know now the advantages of a three-dimensional imaging modalities where you basically overcome that superimposition that X-rays have. So it gives you quite a bit of an anatomical assessment of the area. It's easy to operate. That was very important for us because we wanted a system that could be used not only Monday to Friday, 8 to 5, but also during emergencies and weekends. And we do have quite a bit of turnaround on people. So we wanted something that was easy to be able to manage. Usually once you have the system set up, it takes less than a minute to image. So that's very good. This is a system that's very patient-friendly and, most important of all, technician-friendly. With the shortage of technicians, across the equine industry, for us was very important to have something that my technicians didn't get frustrating managing, and also that the overnight people or the emergency people can manage frequently, just because we do have quite a bit of a emergency caseload. Price to the customer, that's another advantage of these standing modalities, is that they tend to be a little bit in a lower cost compared with the general anesthesia procedures. And in the case of this CT, hard to break, that's the advantage of CT being made for horses specifically, is that it can withstand a kick or a hit. And as you probably, or everybody knows, when you get a system like this, it has to last quite a bit. So that was something that was important for us. Disadvantages, just like all the systems, there's always a initial investment, not only on the system itself, but the room that you have to get for the system, and there is an annual maintenance of this equipment. Clinical application, for us, we use it a lot on lamenesses. We've been able to replace at least 70% of our radiograph taking. Yeah, the CTs are usually double the price of the X-rays, but my caseload or my clientele has been very happy, paying the extra or double the price to get all the information that the CT is going to provide. So we use it quite a bit for lamenesses. It has a very good advantage for surgery, especially the ability to have that three-dimensional imaging modality, and it helps you quite a bit for surgery pre-planning. Like I mentioned beforehand, on emergencies, just like you see on that picture, and yes, that horse did get CT too. We use it quite a bit for emergencies as the first line imaging modality. So that's another plus. One of the, I would say, collateral damages, and I say damages because I am not a big fan of dental diseases. I don't do a lot of dentistry, but the quality of image that you get with a CT compared to X-rays in the skull area was a pretty big plus when it came to the horse itself, and having a good diagnostic technique in order to diagnose all these dental skull issues, and the CT has been quite a bit effective for that area. And when it comes to all other areas, we've put in, if it fits, it goes in. That's basically the rule. We've been able to put foals, ponies, look at their abdomens, thorax. We've put other species in there, so it's a very versatile system. When do we need CT? And I think this is overall, in general, for all these imaging modalities, is when we can't make a good diagnosis with X-rays and ultrasound, or when we have an incomplete diagnosis or an inconclusive diagnosis with these two modalities. What we have to remember is that for the X-rays to show you a lesion, it requires a certain amount of bone damage. And a lot of the times, one of the frustrating things for us that we work with sport horses is several times we can have the area localized. We take some images and we're not seeing it. And it's not that we can't see it. It's not that it's not theirs. We just can't see it with X-rays, and that's when we apply these next level modalities. Another reason to use it, and we do this quite a bit, is when X-rays and ultrasound just doesn't make sense on what's going on. The key, though, it has to be the area of interest, or hopefully you've been able to localize that area. For a complete evaluation of a complex anatomical area, it's also been the CT is pretty useful. Surgical planning, like I mentioned beforehand, and the ability to get a prognosis has helped quite a bit with these standing modalities. Requirements, the CTs, and the fact that you can cover quite a bit, a large area. It's not meant for fishing expeditions, right? If you're going to use this, you want to make sure you do a good examination and you have a very good educated plan on what the area of interest is, either by localizing it, or if you have any finding that basically you want to characterize a little bit better, and you're going to ask for this next level imaging modalities. Just like I mentioned earlier, localizing is good. You always want to make sure you localize the area, and remember that you have to be prepared to image a little bit further beyond your blocks, just because of diffusion. So keep that in mind. When it comes to papers published, this is probably one of the first papers at 2022 when it came to standing modalities. There's a lot of literature when it comes to CT, horses, and limbs under general anesthesia. But now that we have these standing units, we're starting to see a lot of these papers. This was one of them, published in 2022. This is the Calibra system. They had a very good quality of image in their system. They had at that point 32 horses that they were done in 10 months. And one of the conclusions or in their highlights of this paper is one of the things that they struggle a bit is with the positioning of the horse and the fact that a lot of them sometimes required a repeat scan due to the fact that they would just slip down the gantry. That slipping usually was causing movement, so that can affect, and a lot of the times you have to repeat these images. You can get a very good quality of image when it comes to the feet and the fetlock area, but when you have to image higher up, you can get a little bit more motion in the image. And also these units can be used under general anesthesia. After that paper, also in 2022, University of Wisconsin, Dr. Bruns published this paper with the other FEM-beam system, which is the ASTO-CT. In their paper, basically they had a median of one scan, which is it's more natural and easier for the horse just to stand there. You don't have to move the leg in order to get image, so the horses tolerate it pretty well. In this case, the CT resulted in a new or a confirmed diagnosis is 99% of cases, compared to 45% of cases when it came to X-rays. So that was a big plus with using this systems. Also in that paper, they reported quite a bit of encouraging results when it came to soft tissue, and also complementing that soft tissue with the use of ultrasound in order to get diagnoses when it came to soft tissue injuries. So that's one of the things that was a good plus or something reported in this study. And one of the things that came in also in this study was the fact that you had both pair of limbs facilitated the interpretation, and that was something that's a pretty positive bonus when it comes to at least the ASTO system, that you can compare with the other side, and as we know, when we have asymmetry or changes within those areas that's different than the other side, and it correlates with our exam and our findings, it's something that it might require further evaluation. So this other paper published in 2023 from South Africa, they had quite a large number of horses. They did have this system that they built, and they were able to get a human CT and tilt it. So they were pretty, they managed to get this system in order to function for them. And they were able to get quite a bit of diagnoses when it in regards to a single area, multiple areas, and they do report quite a bit of diagnoses when it comes to soft tissue. So the CT is not going to be compared, obviously, with an MRI when it came to soft tissue, but a lot of these standing modalities do have quite a bit of information, and this can be supplemented with ultrasound and be able to help you with that diagnosis. They claim that it took them around 20 minutes to do the whole process, which is quite a bit fast, especially when you have to put a lot of these horses or you have a lot of lamenesses that need imaging. So that's another advantage of this system. And the same thing that all systems have in common, that one of the disadvantages is if there's a little bit of motion, then you just have to repeat the image. But it's a very fast acquisition of the image. Just like with general anesthesia, MRI, and CT, there's a lot of comparisons between CTs and MRIs. This is a paper that got published this year, and it focused specifically on standing modalities, combining a low field MRI and a FEM-beam CT. And in this paper, one of the big conclusions is that you not only have the ability to use the CT or the standing modalities with ultrasound, but you could also, if you have a standing MRI, you can get the best of both worlds and complement and provide a complement both of these techniques and in being able to get a more sensitive or accurate diagnosis. So this paper did a great job on demonstrating how using both of these modalities can help each one individually to get a good diagnosis. When it comes to our caseload, 2026, this is something that we've had a lot of numbers, but as every veterinarian in academia, trying to find the time to write it is a different story. But in our caseload, we've put animals of small like pony or big Shire horses. So we've used it quite a bit. We basically, as it stands right now, we've done 1,109 scans total, which 721 are limbs. So that's been done from 2019 to 2025. So that's quite a bit of large amount of scans and limbs. Most horses, you get a scan in the first time. Sometimes when there's a little bit of motion, you have to repeat it, but most of them, you get it in the first try. Our findings, the same as the Wisconsin paper, is that we do get soft tissue diagnoses, especially when it comes to proximal suspensory tendon injuries, anything above the fetlock and I would say above the navicular bone, you're able to at least be suspicious of and be able to complement it with ultrasound. And the biggest plus is the fact that these interpretation of these images are facilitated by the fact that you have the other side that you can use for comparison or in case you have any doubts on what you're seeing. This is preliminary data that we have specifically about the hawk. I got to thank Dr. Dana Clef, who's my intern and future surgery resident, because she's looking into these cases. And these are specific 183 cases, specifically horses that had hawk CTs done. And what catches the attention here is this lower area, 3 diagnoses, which these are a lot of horses that on x-rays and ultrasound we're not necessarily being able to catch. We all think that it's the regular OA, but these other, the proximal intertarsal joint and the fact that the OA in between the small tarsal joints or bones are also have a big percentage of horses. And these is just preliminary data on trying to see what we're finding and how we're going to correlate that. This is another paper that I included, published in 2023. It was done with cadavers, but it basically did a good job on documenting how CT can reliably find injuries of soft tissue, specifically when it came to proximal suspensory. I think there's a lot of papers that are related to limbs and under general anesthesia CTs that have been published historically, and I think a lot of them, once we get more comfortable using these systems, we're going to start trying to go back and try to compare those studies that were done with the systems under general anesthesia with the standing modalities. When it comes to contrast, this is something else that at least the ASTO CT provides an easy way of doing it. I'm not going to take too much time on discussing these papers, but we know that contrast can help when it comes to CT and analyzing cartilage when it comes to contrast inside the joint. Also intra-arterial contrast has also been described as helping diagnosing soft tissue injuries, specifically with the intra-arterial contrast. So that's something that it's an area that I need to work a little bit more on trying to accomplish with this CT. Down here are images of a horse that I did a venogram. You can see that it's pretty cool how you can see all the blood supply in there, and trying to correlate that with laminitis. These are other images of that same horse, so you do get quite a bit of a good three-dimensional image of these contrasts. So contrast, I think it's a plus, and it's an underutilized tool that, in certain cases it can provide quite a bit of information, specifically if you're not getting the results that you're getting. When it comes to tendon sheaths, CT and contrast has also been reported on general anesthesia systems. And recently in this 2024 paper where on these standing units, they were able to get these contrast CTs on the deep digital flexor tendon sheath and provide quite a bit of an accurate diagnosis. And being able to confirm that intratenoscopically. So it is another area that can be used in bursas or tendon sheath. And these are images of a case that I had, and you can see that it has quite a bit of a good image and detail on the structures that are being imaged when you put some contrast in these tendon sheath. And this is a case where you can see here how there's a tear on the manica flexoria. So with good imaging, you're able to get soft tissue diagnoses. And if you have any concerns, you could always go back and either think about contrast or complementing it with ultrasound. And this paper, I added it. It's a 2025 paper that talks about using contrast in the carpal canal. We know that the prevalence of issues in that area is not that high. However, it adds another diagnostic tool when you have horses that you're suspicious of that area and you're just not getting the diagnosis with the normal ultrasound or x-rays. The CT and the contrast can help you quite a bit. So with that, these are cases that I've had that the CT was very important in order to get a diagnosis. Obviously, because of time, I can't go over in details or with videos and everything. So I just put the signalement there. In this case, this is a horse that on its pre-purchase exam already had a low-grade right front lameness. By the time it showed up in our clinic, that right front lameness has gotten worse to a grade 2 to 3. No improvement with a PD block, but it did improve quite a bit with the abaxial block on that right front. These are the x-rays that we had taken, and you can see some changes in certain areas, but nothing that could explain why this horse was lame and to that degree. And you can see here on the CT how this horse had quite a bit of damage in that P3 area, specifically in the area where the collateral ligament locates. So these are pretty important and I would say pretty significant injuries on sport horses. And once you have a CT, you always try to be better and go back and go, well, what could I've done differently in order to get that same diagnosis with just x-rays? And as you can see in those images, it's just hard to try to see almost that cystic lesion and try to grasp the depth of this injury. This also has a pretty important for prognosis for this horse. So another case, this is a 5-year-old pony of America with another right front lameness blocked to a PD. In this case, the CT not only gave the diagnosis of navicular disease issue, but as you can see here, it had quite a bit of a good image of soft tissue and provided a diagnosis of a tendinopathy at the level of the navicular bone. So we were able to get a good and accurate diagnosis there in order to see what else could we do with this pony. This is another case, a left front, a grade 2 out of 5 lameness that also blocks to a PD. And I included this case because historically we've always been told that when we have horses with calcified collateral cartilages, usually these don't cause lameness, which I would agree with that. However, though, I've been diagnosing quite a bit of horses that do have some degree of bony issues at the level of the junction between the ossified cartilage and P3. And on some horses, I've even diagnosed fractures in these areas. And that, as much as we try to get them with the X-ray, we just are not able to do that. And as you can see here with the CT, on how you can see the changes right here, and also how these changes are affecting P3. So this is a horse that was treated with a whole different areas and different products, and um, basically what he needed is a good rehab program. When it comes to this fetlock, this is a 7-year-old thoroughbred with a grade 3 left front lameness. It blocks to a basisesamoid block. These are the x-rays. The question was, why are we not finding something, or a reason why this horse was lame? And as you can see, pretty significant changes on that fetlock with a complete collapse with that medial sesamoid bone in the back of the cannon bone. And basically this poor horse, the question was, how much more can we inject? And this provided a pretty good diagnosis, and also the prognosis is not that great when you have these amount of changes on CT. What struck me the most, that you can see the x-rays up front here, is you couldn't even get close to this diagnosis or think about what was going on. It was a pretty shocking when we saw the CT images. So the good thing for the horse is that at this point, there's, retirement has to be a conversation that needs to happen with this case. This is another fetlock, a 14-year-old warm blood with a grade 2 lameness, being treated on this fetlock for OA with different types of products. Basically what they had it localized to the fetlock, but they were concerned about why wasn't the treatment working. And as you can see, the changes, once we did a CT, you can see that there was pretty significant changes on that medial condylar area. And there's a reason why at this point the medical treatment was just not working out. So this type of lesion, looking back and looking at the x-rays, you couldn't even imagine that this horse had this amount of damage. And prognosis wise, this also makes a difference going forward on what else can we do for that lesion, and all the risks that can happen with keep on trying to work this horse hard. This same owner also complained on this horse of a pastern injury, so we went ahead and imaged the pastern, and also a fairly significant injury on that right hind pastern that required a good attention. And in this case, with those two injuries on that on this horse, is something that going forward the vet's going to have to think about what the next step with this horse is going to be, and especially when it comes to prognosis. Another case, this is a grade 3 out of 5 right front horse that showed up for arthroscopy. As a surgeon, I get films like this quite a bit. Everybody's worried about prognosis, and doing the arthroscopy part is easy. You can get these fragments out, but what didn't make sense to me is how lame this horse was. So we went ahead and did a CT, and as you can see, there were significant other changes on this area other than just the fragment. Sure, I can go in arthroscopically and remove the fragment and make the x-ray better, but as you can see, this joint had further damage, and this can have a fairly big impact when it came to prognosis. This other case, and this is one of my last ones, this is a horse that had a racetrack career, but then it was bought for a second eventing career, and it had a 4 out of 5 week right front lameness, a pretty significant one. Basically, the suspicion was probably a septic joint, but trying to get a tap didn't help in this case. As you can see with the ultrasound image, there was quite a bit of effusion in that radiocarpal joint. And once we got a sample of it, we determined that sepsis was not a problem with this horse. So we went ahead and did some imaging, and you can see here how on the affected side, there was a pretty significant collapse of the joint between the accessory carpal bone and the distal radius. And when you go back and look at the x-rays, you couldn't even have a hint of that. And this is a DP of that carpus, and you can see that it looks pretty good on x-rays. But when you look at the CT, and this is a comparison between the right leg and the left leg, you see a complete collapse of this joint. And there's no injection or no product that's going to help you with this. And this basically explained why the severity of the lameness. And something that's pretty striking is when you look back and you look at the x-rays, you just don't have any hint of this. So this is why the importance of the CT providing quite a bit of information when the x-rays are not able to do it. And in this case, once we open the joint, you guys can see the large amount of cartilage damage on this radiocarpal joint that just had a very poor prognosis. There wasn't much that we could be able to do. This is another horse. We do quite a bit of hawks here in Minnesota. This horse went lame acutely after a barrel race. X-rays, you couldn't see anything there, but you can see here on the CT images how it diagnosed a fracture of the central tarsal bone. So that was pretty good for the diagnosis. Another horse, this is one that the question was, why are the injections not helping this horse in the hocks? And as you can see already on x-rays, you see quite a bit of significant changes. This is a 12-year-old quarter horse. But when you do a CT, you can see that the changes overall on not only the left hock, but also the right hock are fairly significant, in my opinion, beyond what any type of injection can do at this point. So it truly makes you characterize these cases quite a bit and be able to provide a good prognosis or a more accurate diagnosis. And to finish, just like you've seen in this module, cases about the talocalcaneal joint affected. This is a Clydesdale that was pretty lame on his right hind. This is the key x-rays, and we'll come back in a little bit to it. We did do a low 6-point block, which didn't improve the lameness. Then we did a tabular which it did improve the lameness significantly. And we went ahead and CT it, and you can see the changes here at the level of the medial talocalcaneal joint. And as we go up the joint, we even see a cystic lesion in that area. And you can comparing with the other side, you can see how significant these changes are on this medial facet of the talocalcaneal joint. So when you go back and look at the other images of the CT, you can see right here how it had basically a cyst-like lesion affecting that area. And going back to the x-rays, and these were the original x-rays, the only thing that would make you suspicious of would be the changes at this level, but there's no hint of having a cyst-like lesion or anything like that. So the CT provided quite a bit of an accurate diagnosis there. And in summary, basically, standing CT provides quite a bit of a good diagnostic capabilities, especially being a standing units. Compared to under general anesthesia system, yes, there's a big difference, but this is better than any x-ray that we can take, and it's something that's becoming pretty used in quite a bit of cases. It's a very sensitive tool when it comes to diagnosing pathology, specifically bone pathology and also soft tissue pathology. And the fact that these systems are standing is it's easier, and it's having a pretty big impact in the sense that they're widely accessible, and you know, in the case of our clinic, we're doing quite a bit of them, and I think that's providing quite a bit of a information that we're hopefully going to soon publish about these systems. And that's all I have for today. I'll open for any questions or concerns.